Welcome to Healthcare Nation podcast. I'm your host, Rick Janata, and happy to be here with you for another episode. And once again, I just want to say at the Healthcare Nation, we are committed to bringing you thought leaders in the field and in the health sector across the board in healthcare. And I think we've got a tremendous show today where we're going to talk about electronic health records and data analytics and what's new and noteworthy in that field. But first, a full disclosure, the opinions expressed by the hosts and guests are for informational purposes only and not to be associated with any companies or academic institutions. And please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And for any questions, reach out to us at healthcarenationpodcast.com. And a little bit about our guest today. As I said, data, healthcare analytics, you need an expert, and I'm so pleased to have Dr. Nasim Afsar on the show. Dr. Afsar is the Senior Vice President and Chief Health Officer for Oracle Health, where she spearheads the care team across care quality and patient safety, caregiver relationships, regulatory requirements, and business processes. She's been a physician for many years, brings decades of experience in direct patient care. Formerly, she was the Chief Operating Officer at University of California, Irvine Health, and did a phenomenal job there, both in her role as COO as well as in the strategy office. Prior to that, she was the Associate Chief Medical Officer at UCLA Health in Los Angeles, and she had leadership roles in many initiatives there in quality, safety, patient experience, in the Department of Medicine, and she is also the past president of the Society of Hospital Medicine and has served on the board of directors for that organization for 8 years. And as president, she led the, I would say, really important and strategic discussions about the future of hospital medicine and hospitals in general. So with that, great show lined up. So welcome, Dr. Afsar. So welcome, Dr. Nasim Afsar. Nasim, it is so good to see you and have you on the Healthcare Nation podcast.
Rick, thrilled to be here. I'm looking forward to the conversation.
And full disclosure to those in the audience, I'd be remiss if I did not say this. Dr. Afsar and I worked together at a certain hospital, UCI out in California, where I can say she was my right-hand person and my go-to for so many different things, strategy, development, and just keeping us on the track. So I'm just so excited to talk to you today. And I'm just so pleased at what you're doing and where you're at now with Oracle Health. And with that said, what have you been up to? Tell me, with the last year and a half from Cerner and the transition with Oracle Health, what are you doing there, Nasim?
Yeah, it's been an exciting year and a half, Rick. So I'm currently the Chief Health Officer at Oracle Health. I have a team of clinicians and non-clinicians who really look at how do we improve the performance of healthcare delivery systems in a data-driven, standard way, leveraging people, processes, and technologies. So what does that mean? We have thousands of healthcare delivery systems across the globe that count on us to make sure that we are what we call delivering healthy people, healthy workforce, and healthy business. Healthy people means we are going to partner with healthcare delivery systems to make sure we're delivering equitable, person-centric care and managing populations of patients. So that's stuff like making sure that we don't have disparities in care when we're looking at diabetes management or heart failure. Then we've got healthy workforce, which says enough is enough. We have been pushing down a number of different things on our providers, our nurses, and our healthcare teams for over a decade and expecting them to manage that. We really have to make sure that technology is a tool that helps streamline workflows and helps address burnout, which I hope we get a chance to talk about. So we have a number of different solutions where we work with healthcare delivery systems across the globe to address burnout, which, by the way, I used to think it's a US based problem. Speaking to clients across the globe, it's a global problem.
Yeah.
And then healthy business, really looking at a time of shrinking margins. How do we support healthcare delivery systems to make sure that doing the right thing is generating revenue and margins for them, and really cutting the wasteful inefficiencies that are within systems to help them move forward. So again, happy to talk about all of that. Oh, I will just say this last piece. About 6 months into my time at Cerner, we were acquired by Oracle, which has really been a game changer in terms of having the technologic capabilities, the analytical capabilities to really think about how do we build the broader ecosystem of healthcare. So being able to integrate capital human management, supply chain, that entire ecosystem of healthcare with the EHR data to have a very open, connected, intelligent system of care. So we are on a very exciting journey, and happy to share some of those with you and the audience.
Yeah, I'm excited to talk about it. Now, I think what I'm hearing here is this is well beyond the notion of, let's just say, Cerner being an EHR company. I think not just with what Oracle's brought to the table, I think, but what the evolution of the leadership team at Cerner, clearly that you're part of, and now with Oracle Health, it's well beyond EHR. Is that pretty safe to say?
I think that's a great characterization of this, Rick. When we talk about healthcare, we're not talking about the EHR as a siloed program. The EHR is still critical as the place where our providers, caregivers come to be able to understand what's going on with the patient, document, write orders, be able to communicate with each other. But what we need to be able to care for patients goes far beyond the EHR. And that's the system that we're building. So I'll give you an example. We have a learning health network where over 100 different health systems have come together and provide their data in an anonymous manner for the ability to be able to get access to the entire anonymous data pool. And we can leverage that for research to be able to have insights into health and illness that we have never had in the past. That was really essential at time of COVID, where we were trying to understand trends and patterns in populations. But we also leverage that network to be able to bring innovative clinical trials to hospitals and health systems who did not previously have access to clinical trials. Why did they not have access to clinical trials in those 100 plus healthcare delivery systems? Are a number of smaller community hospitals. There are critical access hospitals. They take care of people in communities where for those patients to get care, they would have had to drive 2-3 hours to their nearest academic medical center to be able to have access to innovative trials. I mean, you and I witnessed that being on the academic medical center side. We had people who came globally to have access to innovative trials. Now, leveraging this larger data set, we can actually proactively identify the people who would benefit from a particular clinical trial, reach out to the leadership of that healthcare delivery system, have them engage with the patient directly. And now we're bringing clinical trials down to communities that never had those before. As a result of that, Rick, our rate of diversity and inclusion in these clinical trials is about 3x what we're seeing in national clinical trials. So it goes way beyond the EHR to how do you really connect this larger world to innovative therapies, to staffing management, to proactive ways of being able to care for patients in this larger ecosystem of healthcare.
Yeah, and when you're addressing the issues that I could say it's more than just crosswalk to the social determinants, it really is getting down to access. And certainly with clinical trials, emerging technologies, I think leveraging all things that are analytic, such as what you just described, is so important and so game-changing for so many people, particularly those that, again, are having trouble accessing the system for a variety of reasons. So just tremendous. Listen, I always like to keep top of mind on my list of questions what's new and noteworthy. And certainly as of this recording, something that I just read today was the FDA-led initiative with Oracle's Life Sciences Division and John Snow Labs, which sounded really, I'll just put it this way, cool to me. Can you expand on that a little bit?
Yeah, absolutely. So this is a really exciting partnership that we are having with the FDA and the John Snow Lab, where by developing artificial intelligence tools, we are extracting critical information from clinical notes in the EHR and the electronic health records. And this will really help Oracle and John Snow Labs to to help the FDA better understand the effect of medicines on large populations of patients. So for example, if you look at a very commonly prescribed asthma medication, montelukast, and its possible effects on mental health, this 2-year project will demonstrate how to use machine learning and natural language processing technology to really leverage that unstructured data and have those new insights. It's real world data, right? For us to really be able to see once the clinical trial has ended and we have results, how does this actually look when you put it out in the real world? What are the unintended consequences? And those are insights, Rick, that we just have never had in the past, right? The gold standard was you run the clinical trial and then you run with the results of the clinical trial until the next one comes out, which oftentimes is not for a long time. But at the same time, the population that uses the medication is very different than what's reflected in the clinical trial. How they use the medication is different than what's reflected in the clinical trial. And in the past, we never had a feedback loop to say, what does this look like in the real world?
Yeah, and I think about those feedback loops, and it brings me to really the role of data and connectivity and what you're doing at Oracle Health. And kind of in that is interoperability and that wearables, other ways to acquire passively and actively that level of information. Can you comment on that? You know, really the data connectivity and that thread that runs through all of those variables?
Yeah, our goal here is to really create the health platform that's going to be open, connected, and intelligent. And that connected piece is the interoperability piece that's absolutely critical. Here's why, from my standpoint, this is absolutely essential. We have an 80% problem today, which is only 20% of what determines someone's health happens within the four walls of a healthcare delivery system. The 80% of what determines our health, as you know, and you and I did a lot of work in population health management together, but that 80% is where they live, where they work, what they have access to, their behavioral habits. That information, for the most part, does not get into the healthcare delivery system and does not get leveraged and utilized. So interoperability, or that connectedness of the broader data set, so to your point, wearables, other devices that people use, becomes really important as a way to say, how is the person functioning in the real world, and what are the ways that we can help support and assist better lifestyle choices, or be able to support and provide information so that the person can see based on their preferences and values where they want to go. And a lot of that, honestly, it has to be consumer driven, right? So the individual has to have private data where it's working to be able to provide better decision making for them. I think that that's kind of the future of where we're ultimately getting to, is how do we leverage this broader ecosystem of data for the individual to be able to make better health decisions as they move forward.
Yeah, great points. And I want to preface with what I'm saying with the obviously the need for security and HIPAA and privacy. But when you look at the Internet of Things, the Internet of medical things, the Internet of my things, that level of connectivity, and you link it to really the important patient reported or consumer related information, it could really create insights in
Yeah.
clinical care that heretofore we just never had access to. And unleashing that, I think, could help us leapfrog and, as I say, far too often get further faster on so many different issues. Would you agree with that?
Absolutely. I think about a very simple example of caring for patients with diabetes. Again, my health system centric view, the provider centric view of this, had told me that the patient comes and sees you once a month or once every other month. And the magic that happens in the office is what determines how well their diabetes is controlled, right? The reality is far from the truth of managing something as complex as diabetes or other very common chronic diseases. The reality is, again, where that patient lives, what they have access to in terms of fresh fruits and vegetables, fresh foods, what they have access to in terms of their movement, what their day-to-day job is, and what barriers that puts up in terms of their ability to care for themselves. All of those elements really play a much larger role in diabetes care than purely the medication that they're going to get from a healthcare provider. And to your point, up to this point, we really haven't had much insight into that 80% and haven't leveraged that to better help patients. I think that's really the exciting future that we're looking down on, is how can we enable the consumers, the patients, to be able to make better health decisions as a result of providing them timely information.
Yeah, I wanted to ask you with respect to that, and really the theme that we're talking about here. Top of mind for everyone right now is really artificial intelligence. I think it's up there. Certainly, it's served up in so many conversations when you talk about technology, or really the advancement of medicine. What role does something and some features, certainly of artificial intelligence and machine learning, play in precision medicine, predictive analytics, the trends, the clinical data that you're looking? And is there a place for that actionably in the electronic health record for clinicians to really work with in a more of a real-time fashion versus retrospectively?
Yeah, great question, Reg. So I want to kick off the discussion first by saying AI and ML are an absolutely critical and exciting domain for us to explore and leverage in health and care. And we have to be very thoughtful to ensure that these algorithms are not continuing to perpetuate the disparities that occur in healthcare. So I'm part of a expert panel with HRQ where we're looking specifically at what are the guidelines and the boundaries by which we have to be thoughtful about having AI and ML driven algorithms out in healthcare delivery systems. And the data on this is fascinating because you will have an algorithm that supports clinical decision making appropriately in one community, but you take that to another community and it actually exacerbates the disparities that exist. So we have to further the science here and further the accountability on what we're putting out there. And I say that because I am an avid supporter and very passionate about health equity. It's something that my team works on extensively, and it's something that we're trying to hand in hand with developing technologies, really take a thoughtful approach on. But to your point about kind of the potential of this, today that is everything from proactively identifying a patient that has a high likelihood of becoming septic or having a overwhelming infection that has a high mortality, and alerting the providers so that the nurses and the physicians can proactively intervene and prevent that. And there are a number of those algorithms out there that have shown reductions in mortality. It's in alerting proactively for other quality and safety issues in patients. But I think kind of the future state of that is how do we, again, leveraging interoperability and data from multiple resources, ensure that the chemo nurse who's going bedside to deliver a chemo regimen, a new chemo regimen for the first time, how is that alerted so that we provide her or him with the right support and the right supervision to do that work? So how do we really pull together not just the clinical data, but the broader ecosystem of healthcare? Again, it's supply chain, it's human capital management. It's how do we leverage all of that so that proactively we are making better decisions and we're enabling better decision making. We currently have a very robust real-time health systems, a command center that can help proactively with appropriate staffing depending on the acuity of patient illness, depending on algorithms where they calculate how much time should the care of a particular patient take, and then making sure that a nurse is not given an overwhelming load while another one is having an easier day or an easier night. So leveraging big data to say, based on significant data, you're going to need to pull this group of patients together versus another group. So I think that the potential to really deliver better quality, be able to advance safety, grows when we don't just focus on the clinical quality data and really look at the broader ecosystem of healthcare.
Yeah, I've often thought because of the pressures of shortages and just changes in the workforce across the board, that new and emerging models of care would have to look more like care traffic control, to kind of steal a phrase from air traffic control. And that one way to be really effective at that, certainly for reducing error reduction and maybe intervening in advance of some negative outcome, would be cues and prompts that are acquired just in the ecosystem as you described it, that could alert folks if there was an issue, if a patient was declining, or if there was some repetition in some action that would signal clinical degradation. For me, that's a promise that technology can hopefully fulfill, that also checks the box into some realities, like there's not going to be enough nurses and there may be shortages of some highly skilled content experts where we need them.
We've been doing a lot of work in how do we make sure that we have a healthy workforce. And again, I talked earlier about a lot of that is how do we streamline workflows, really get rid of arcane or historic things that people should not be doing. How do we leverage technology to be able to expedite some workflows? But one of the innovative things that we've tried now with a couple of large healthcare delivery system is virtual nursing. So as you know, we had a large number of nurses who unfortunately left the workforce with the pandemic. We are able to now leverage the expertise of those nurses by bringing them back virtually and having them engage with the patient and the family during the times that are very resource intensive in their care delivery when it comes to doing admissions and doing discharge education and planning. So the virtual nurse joins the patient and family on an iPad or a video audio enabled device. They then, in a very thorough manner, go through all of the admissions processes. We found that when we do that, we're actually able to close far more quality of care gaps because, again, the virtual nurse is thoroughly going through those and enabling now the bedside nurse to continue to run around and actually deliver care. And And this has really helped with the sustainability of work for the bedside nurse who's often having to manage not only acutely ill patients, but having to admit patients, having to discharge patients. Similarly, with discharge too, we're finding it's really expediting that time to discharge and also addressing a number of issues that would have previously not been addressed. Because again, the virtual nurse is there available and has the time to now care for a patient who has healed and doesn't have acute needs, but has a lot of questions about what their post-hospital follow-up looks like.
So important. I see that as it's care shifting, but you're not losing the care. I mean, the
Yeah.
care piece is still there, which is so absolutely important if you're going to maintain, that compact between clinician and patient, that relationship, which I think is at risk far too many times when we look at the challenges that are out there in the system across the board. But
We're
brings
almost
me to a
augmenting the
g-
care, right?
right, right.
It is a team-based approach, which I think, it took us a while to get there in healthcare, but healthcare has become far too complex for us to have individual heroics. We need to have that team-based approach. Just a slight funny side note, but it drives home the point. When I was training in internal medicine, my attending was saying that at the time of his training, when a patient came in with a myocardial infarction, so they were having a heart attack, they connected them to a morphine drip and put them in a room for 3 weeks because that's all they had. And now there are actually some cardiac benefits if you're having a heart attack to having a morphine drip and reducing your
Turn the
acid
lights
load.
out,
And,
no
yeah.
stress. Yeah.
But his point was that that's all they had
Yeah.
in their arsenal of care was morphine, a room. If you made it, great, you got to walk out. And if you didn't make it, unfortunately, that was it. When I was training, if we got a call that a patient was coming in with a myocardial infarction, there were 6 to 8 medications that we needed to make sure that we started right off the bat. There was door to balloon time where we had to make sure that we got the patient from the time that they hit the ER to getting them to the catheterization lab for the interventional cardiologist to visualize their vessels and be able to open up those those vessels. My point is within a lifetime, care has gotten infinitely more complex. And the only way that we can manage that is through a team-based approach that's enabled by technologies. The technology isn't the thing, the team is the thing that delivers it, and the technology is the enabler that really should help care providers be able to do their job far more easier than they are today.
Yeah, I couldn't agree with you more, but it begs the question, so much information, so much technology, really so much responsibility, even within a team. A lot of folks are just going to jump to the information overload, clinician burnout perspective. What are some of the ways that you and Oracle Health are addressing that issue, which I think, and we saw this with the pandemic, and I think it's a big reason why so many folks are even considering, whether they're going to stay in the profession or not. But how are you addressing the issue across the board?
One of the really exciting and impactful things that we're doing is called seamless exchange. I'd love to tell you about that actually. So when we talk about interoperability, part of the challenge is you open up the floodgates and then you get a ton of redundant information, or you get a ton of information that's not really clinically useful. So what seamless exchange does, and we saw this with one of our healthcare delivery systems, where you won't believe this, Rick, over 99% of the data that came in was redundant, was duplicative. And so what the system does is that it actually gets rid of it, it deduplicates all of that data and it puts in front of the provider the elements that are actually new to the medical record. It also goes one step further and says, well, if I pulled this, if it's a vaccination record and I pulled it from the public health database, that's likely going to be okay. And again, you can kind of set those rules at an institution by institution level, but many institutions say it's coming from the public health department. You can just push it to the EHR, and now that information is just there. If it's coming from a different system, then you may want to review it before you're adding it on. But I think again, you brought up a really great point, which is more data is good, but it's also overwhelming, and at some point people can't process it. Our cognitive ability to actually be able to process and then do something useful with that information, I think that's already become overwhelmed. So looking at how do we actually get the right data at the right time to the right person becomes absolutely critical. I think the next step that we're working heavily on is data is great, intelligence is far better. So how do you actually take the data and provide intelligence so that the clinician, the nurse, the caregiver can actually then leverage that to do something differently, to do something better for the patient in front of them?
Yeah, so important. I also think about agency over one's health and really an individual's access to their, let's just call it their own medical records, their own data. Any initiatives that you're doing at Oracle Health to make sure that the individual, the patient, can leverage their clinical data more effectively?
Yeah, so from the very beginning, we were always tremendous supporters of this is a person's data. It has to be available to them. It has to be private. It has to be secure. And we've done a lot of public advocacy around this. Also, in the early days of interoperability, we were heavily involved in setting up and being part of the founding members of creating interoperability for systems. I think that the more we move forward, the more we have to think about, again, not just the EHR data, because to your point, this goes far beyond the EHR, but far more about that health ecosystem. And I keep going to health because it's really more than health care, right? The majority of people's lives should be spent in health, not on the healthcare front. But as we have data coming in from wearables and a number of other domains, as we look at the Internet of Things, that that place where that gets stored, it's secure, it's private, is going to be absolutely critical. That's the cloud. That's where you can have a robust place where data can come in from multiple sources. It can be connected. Intelligence can be applied. Analytics can be applied to it to create intelligence. It is private. It is secure. As you know, we work with government agencies both within the U.S. and outside of the U.S. This is a critical issue for a number of key entities, as well as individual people, as they're looking at their data being leveraged and used in all sorts of inappropriate ways out there. So we're doing a lot of work in that area and have been through the cloud.
Yeah, and that's so important. Obviously, as you're inferring here, the nefarious ways and access to data and all that. On the optimistic side, I'm hoping there's a way for also an individual to promote their own wellness and preventative care, as you said, not just being focused on the healthcare side, the illness side, the disease side, but really saying, can I leverage this data to stay healthy, and can I use it as a guideline for myself?
Yeah. Well, I think, one of the things that we have not done well in healthcare, Rick, is we haven't looked at what is the best way to connect with different people, right? We've had the approach of one size fits all for the most part. I remember, gosh, now a decade ago when I was responsible for a population health program, every year we would send out a letter to all the patients who had lapsed on their colorectal cancer screening for that year, who were in our medical group. And we would send them a letter. A way a physician writes a letter. If you give me a page, I'm going to fill every single blank spot of that with chock full of information on why colorectal cancer is an issue, all the different modalities that you can get screened, why it's important to do it now. And we would send this letter with a fit kit, which is a home-based testing for those in the audience who don't know, where the person has to handle their own stool, not pleasant, provide a smearing of that, and then mail that back to the healthcare delivery system for us to then run a series of tests to look for potential signs of colon cancer. And that's in lieu of doing a colonoscopy, but because it's not as good, people have to do it annually. So we would do this. We would send them the fit kit, we would send them the letter, and not surprisingly, we wouldn't get very much back from them. We then looked at how do we actually think about the consumer in a different way, think about how they would like to be communicated to, and applied a couple of behavioral economics principles like fill out or complete this fit kit in the next 2 weeks. Because if you give adults deadlines, it turns out that more people actually do something. You have been selected to receive this fit kit. People like to be selected. And when we said that, people wanted to do the fit kit. So of course they were selected. They had last on their colorectal cancer screening. And we decluttered the letter to just key messages and key points. We got statistically significant results in the number of people who returned their fit kits with the letter that was more consumer person centric than the one that the physician, the CMO of the medical group had written. And I think, there is a lot that we need to do still, Rick. And how do we actually connect with the people who ultimately need to receive this information in places where they need to receive this information? You and I did but it's at time of COVID at our prior organization, when we were leading vaccinations for our county, we realized that there were a number of vulnerable communities who were not getting vaccinated. It was true of many counties across the US. We started partnering with community centers and churches and spent weekends vaccinating people in places that they trusted and felt more comfortable in, with support and endorsement of the larger community. I think we have to leverage our data more effectively to better understand what is the best way to get information to the individual for them to be able to make better choices. So that's, I think, there's a lot of really exciting work going on around that, and hopefully at future podcasts, I can share some of that with you.
Oh, we love that. We love that. The theme of access, it pops up every single podcast that we have. And it's so important. And access to information, to data, to intelligent data, as you said, can really make the difference between, an individual's trajectory being positive or negative. So important. The time goes so quickly, but I have one last question. And yes, it has to do with, really the future and the future of healthcare, certainly as we know it. But more importantly, for our listeners and for me, I'd like to know what you think of the future as you see it, particularly given your experience and your role at Oracle Health. Paint us a picture of what things are going to look like from that perspective in your wheelhouse there at Oracle Health.
Gosh, how much time do we have? I can go on this topic for a while. Listen, the future has to focus on health. That's an imperative. We have to get out of the cycle that we're in, where we have increasing numbers of chronic illnesses, increasing disease burden for our citizens. It leads to poor quality of life for the individual people. It comes at a cost at a national level. No one benefits in that scenario. So we have to switch from where we are, which is a nation focused on illness and sick care to a nation focused on health. And globally, there are a number of best practices that we can leverage and customize to the needs of our people. It has to be equitable. We're at a point where it was never acceptable, the disparities that we had in care. Enough is enough. We have to deliver care, deliver health that is equitable. We talked about health equity more than 20 years ago when I was in training. It breaks my heart that the numbers have gotten worse and worse, and we haven't. There's a lot of great work that's going on. I'm very hopeful, but we haven't figured out how we're going to fundamentally address that. So I'd say that the qualities for me of what that future state looks like is a focus on health in a just and equitable society. Now, what if you do the click down on that? From my perspective, technology is what's going to be the enabler to help us actually have intelligent insights and the tools to make that possible. And we have to do it together. That this is not a one organization problem. This is not a federal government problem. This is a larger health ecosystem problem that we really need everybody at the table, from people and communities to healthcare delivery systems, to tech companies, to retail, payers, public health agencies. We need everyone at the table to help figure this out together. I told you I could keep going for a long time on this, but I'm going to pause there.
No, listen, speaking of having the right folks at the table, I know that you will have a place at that table. You have so much to offer and so much to add to that conversation, not only now, but well into the future. And I just want to thank you for being on the show. Just fantastic, obviously, insights and perspective, and also great to see you again. So with that, Dr. Afsar, Nasim, thank you so much for being on the Healthcare Nation podcast.
Thank you so much, Rick. Really enjoyed the conversation.